is HIV. HIV stands for Human Immunodeficiency Virus. The virus attacks the human immune system, weakening it to the point where the patient acquires various other illnesses due to the damage caused by the virus. HIV essentially turns your white blood cells into evil HIV replicating factories. These factories make more copies of the virus, which make more copies of the factories. How this process works is fiendishly complicated and really a story for another time, but generally speaking, once HIV enters your body, it locates a special type of blood cell called a CD4 cell. These important cells are part of your immune system and they lead the attack on infections in your body. Once inside the CD4 cell, it will convert the cell into a factory to create its own HIV viruses. These viruses go on to locate other CD4 cells and turn them into more factories. Once enough of these cells have been converted into these factories, the body's immune system is weakened and the person acquires other illnesses. You cannot rely on symptoms to know whether you have HIV, as the usual symptoms have literally hundreds of different, more common illnesses they are associated with, ranging from medication reaction or side effect, bacterial pneumonia, traveler's diarrhea, SARS, viral gastroenteritis, cystic fibrosis, influenza, lung cancer, sarcoidosis, tuberculosis, anemia, food poisoning, irritable bowel syndrome, inflammatory bowel disease, Crohn's disease, emphysema, hyperthyroidism, lung cancer, multiple sclerosis, radon exposure, sickle cell disease, diabetes. The only way to know if you have HIV is to get tested. It's important to note that some people experience flu-like symptoms shortly after infection, but not everyone experiences this, and you shouldn't assume you have HIV just because you experience these symptoms. Once you test positive, you'll be monitored every few months by a doctor. They will monitor a couple things: healthy CD4 cells and your viral load. Generally speaking, when the number of friendly CD4 cells go down, HIV cells or a person's viral load go up. Measuring someone's CD4 count and viral load are how doctors determine how healthy an HIV patient is. A healthy person's CD4 count is between 500 to 1,000. If you're in this range, you're generally not recommended or needed to start treatment unless there are other concerns, such as pregnancy, young age, or other complicated problems. Once your CD4 count falls below 350, it's time to start considering treatment. Treatment is a bit of a can of worms, so we'll cover that in a different video. But left untreated, a patient with HIV will develop AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. A patient is diagnosed with AIDS only after they have reached certain criteria. One or more very specific opportunistic infections, very specific cancers, or incredibly low CD4 cells. Once a person has been diagnosed with AIDS, medical intervention and treatment is required to prevent death. If a person with HIV is on a treatment plan that is followed, it is incredibly difficult for someone's immune system to deteriorate to this point. To sum up, once HIV enters your body, it uses your own immune system to make copies of itself. The only way to know that you have HIV is to get tested. If you test positive, you will be monitored by a doctor and put on a treatment plan when needed. Left untreated, a patient will develop AIDS. But there's no reason to be afraid. People of HIV are able to live a completely normal life. The treatment available these days can essentially suppress the virus so it doesn't affect the person. HIV has become more of a chronic pain in the butt than a life-threatening illness. If you want more information, I've put a lot of links to great resources down here in the description. Also, don't forget to like, comment, and subscribe to this channel. And if you want more, you can head over to my other channel for my semi-weekly vlogs. So yeah. About a week later, there's no trace of snow. It's hard to do without a screen.